the most basic needs we as human beings have is to feel comfortable and rested. Comfort is the need to feel free from pain, both physical and emotional. Hi, I'm Nancy Radke, instructor in community health education, and today I'm going to talk to you about assisting patients with their comfort needs. Helping patients achieve a level of comfort is a major responsibility of caregivers. There are many things that affect a person's comfort. Things that affect our physical comfort would be an unfamiliar environment, lack of privacy, such as sharing a room in the hospital, a nursing home, or an assisted living facility with another person. Noise from the hallway, from your roommate's television, radio, or even their visitors. Extremes in temperatures, either too high or too low. Illness or injury and pain can also affect our physical comfort. Lack of sleep, air, and food, and even too much or too little activity all affect our physical comfort. Then there are the things that affect our emotional comfort. Being fearful of someone or a situation, maybe living alone for the first time. Worry over oneself, your loved ones, or friends. And anxiety and stress that can come with everyday life will also contribute to emotional comfort. People suffer from discomfort when their physical and emotional needs are not being met. When the needs are not met, they can interfere with a person's level of comfort because they cause stress and anxiety. Part of feeling comfortable is the need to feel rested. Rest is a state of physical and emotional comfort. You know that a person is rested because they demonstrate behavior that is calm and relaxed. All of a person's basic needs have been met, and basic needs such as bodily cleanliness, hunger, and elimination have to be taken care of before effective rest is possible for any of us. The environment needs to be calm and quiet to encourage rest. If a person is sick or elderly and becomes tired after routine activities such as bathing, dressing, or eating, they should be allowed several rest periods throughout the day. You'll need to watch for clues that your patient needs a nap, such as if you notice that they're falling asleep in the chair. Offer to put them to bed for a short nap. The need for rest is going to vary from person to person, and some may need several short rest periods during the day, while others may need none. As the caregiver, you will want to be aware of when your patient or resident is demonstrating a need for rest. Sleep is also a basic human need. Sleep is the purposeful loss of consciousness. It allows our bodies to be restored and refreshed both mentally and physically. Despite some people's claim to the contrary, adequate sleep is necessary for all ages in order for our minds and bodies to function properly. It's during sleep that there are fewer demands placed on our bodies because activity is decreased. Our body has a chance to rest and refresh itself. The need for sleep decreases as we get older, but it is still very important to our well-being. Studies have shown that when we become sleep deprived, our bodies will attempt to catch up on weekends or other days that we may have off. Let's take a look at the sleep needs throughout the life cycle. It may seem to us when we're caring for a newborn that they are awake all the time, but most will sleep in 3 to 4 hour cycles for a total of 16 to 20 hours of sleep each day. Toddlers need between 12 to 16 hours, and this would include their nap time. Preschool children and elementary school children need about 10 to 12 hours per day. And adolescents or teenagers, even though they may be very busy and involved in many activities, have a need for 8 to 10 hours of sleep every day. Young adults, ages 18 to 40, also need about 8 to 10 hours a day. By the time we reach middle age, which is between the ages of 40 and 65, the need decreases to about 7 hours per day, and the elderly over the age of 65 require between 5 and 7 hours per day with rest periods as needed. Sleep is a very complicated process. We should always believe the person who says that he or she did not sleep, even if it looked to us like they were sleeping when we made our nighttime rounds. The quality of sleep is determined by the person who experiences it. Lack of sleep or sleep deprivation can show up in some very troubling behaviors. We may see things such as personality changes. Perhaps the person has become irritable or very moody, poor memory, hand tremors, poor judgment, just making some very bad decisions. If a person has experienced prolonged sleep deprivation, depression may set in. Restlessness and hyperactivity are also things that we may see in someone who's been deprived of sleep. Research has shown that our reflex time will be slowed and that there is just an inability to cope with simple situations of everyday life. Everyone has a sleep-wake cycle. This is an internal body clock that tells us when to go to sleep and when to wake up. This is called the circadian rhythm. There are two types of sleep: non-rapid eye movement, or non-REM, and rapid eye movement, or REM sleep. Non-REM has 4 phases moving from light to a very deep sleep. In the early phase, the person is easily aroused. REM occurs as the person falls into a deeper sleep. During REM, the brain is highly activated. Dreams occur during this REM phase. A person usually will fall into a REM sleep within 60 to 90 minutes. There are normally between 4 to 6 cycles of non-REM and REM sleep during each 7 to 8 hours. It should be noted that stage 1 of the non-REM is usually not repeated throughout the sleep cycle. Your understanding of this may help you realize that patients who are hospitalized or residents who are in a new environment may not experience prolonged periods of sleep time. Their sleep cycle may be interrupted by the many routines of the nursing unit. Patients may then wake up feeling tired because of a lack of adequate REM sleep. It is very important for caregivers to be aware of the need to keep the environment quiet and disruptions to a minimum. The caregiver has a very important role in ensuring that a person receives a good night's sleep. And there are many things that we can do for this. The first might be to check the resident's or the patient's care plan. Become familiar with their sleep routine. Assist with any bedtime cares. Ideally, it would be great to take a whirlpool bath, but at the minimum, help them with a partial bath, oral hygiene, and take care of their toileting needs. After that, assisting them into clean, comfortable, loose-fitting night clothes is very appropriate. Offer a back rub and assist with positioning to make them more comfortable. Check their environment. Close the drapes and darken the room. Turn down the bed and straighten the sheets so that there are no wrinkles, which would make it uncomfortable for them to sleep. Is there a path cleared to the bathroom? Maybe they'll need to get up during the night. Are there any unpleasant odors in the room? If so, eliminate them.